In life, Keith Wood was full of adventure, a naval veteran with a flair for fun. It all ended with a gash across his head, a blood clot in his brain, the result of an unprovoked attack inside the home intended to care for him.
I whispered into his ear, "Parting is such sweet sorrow. I'll be here in the morning if you're still here. If you're not, I'll understand." And I was home about an hour when they called to say he died.
His wife and caregiver says she soon learned the man who attacked Keith, a resident with a history of violence, was charged with manslaughter. The unpredictable and sometimes aggressive effects of dementia are seen as a key reason behind the escalating violence. They were evident in this case CBC reported last year when a resident hurled a chair at Meyer Sadoway. The attack continued, and Meyer would later die. At least 29 deaths in Ontario homes over 6 years have been deemed a homicide.
There is a total consensus that there is a critical situation in long-term care in which the acuity of the residents is extremely high, the care levels are too low, and the violence levels have really just skyrocketed.
Resident-on-resident violence surged 105% between 2011 and 2016. Ontario's coroner has repeatedly warned the issue of resident-on-resident violence is an urgent and persistent issue. Those who live in the homes are arriving later in life, living longer, and more often with dementia, which can produce aggressive, unpredictable behaviors. Yet a new report from the Ontario Health Coalition says staffing levels are decreasing relative to the growing needs of our parents and grandparents in the homes.
Okay, David, what are Ontario health officials saying about this?
Nothing. They wouldn't talk about the homicides being discussed today. We do know, though, that some homes are trying to address dementia in different ways, even with architecture, changing it so that those with dementia who wander aren't stuck up against a wall, essentially. That reduces some of the aggression. It's shown to be promising. But at the end of the day, this report and many others before it have pointed to staffing, the lack of staffing in particular. 62% of the aggressive incidents, according to one study, have been unwitnessed by staff. Now, staff can't be everywhere all the time, but when they aren't there, bad stuff can happen.
Okay, David, thank you for this. Appreciate it.